Hello, I'm Ophelia. I recently completed a Master of Nursing at Southern Cross University. Before studying in Australia, I worked as a registered nurse in Taiwan for nearly 3 years. Since moving to Australia, I have completed clinical placements across a range of specialties while working as an AIN. Thank you for taking the time to consider my application. First question is about the working with scope. It means knowing when I need support to provide safe patient care. During my coronary care placement, I was caring for the patient receiving the heparin infusion. After reviewing the medication chart and the patient's APTT result, I recognized that adjusting the infusion rate was outside my scope as a student nurse. So I discussed my assessment with my body nurse, and together we reviewed the patient. She adjusted the infusion according to hospital policy while explaining her clinical reasoning. This experience reinforced that I recognize my limit, and seeking guidance isn't a weakness, it's a part of being the safe and accountable nurse. Whenever I'm unsure or something is outside my scope, I seek the guidance early to make sure the patient receives the safe care. For the second question is about medication safety. It starts before I administer any medication. I first make sure I understand why the medication has been prescribed and whether it's appropriate for the patient's current condition. I review the medication chart, check allergies, recent observations, and any relevant pathology results. Before administering the medication, I confirm the right patient, medication, dose, route, time, and the patient's right to refuse. For high-risk medication, I follow hospital policy and complete an independent double check. If I'm even unsure, I stop and clarify before proceeding. If a medication error occurred, my priority would be patient safety. I would assess the patient, notify the team leader and the medical team, monitor the patient closely, and document the incident and complete an incident report. Afterwards, I would reflect on what happened and use that learning to improve my future practice. For the next questions, when several things happen at once, my first priority is identifying which patient is at the greatest risk of immediately deterioration. In this situation, I will attend to the patient with the chest pain first, because chest pain with the pallor and the diaphoresis could indicate acute coronary syndrome and requires urgent assessment. I will stay with the patient, perform a rapid A to E assessment, check their vital signs, and notify the team leader immediately. At the same time, I will ask another staff member to assist the patient who needs to the toilet to reduce their fall risks. I also inform the radiology that the CT transfer may be delayed because we have an unstable patient in the ward. Once the chest pain patient was stable, I will then assess the patient with nausea and provide appropriate care or escalate if needed. To me, good prioritization is about recognizing deterioration early, communicating effectively with the team, and also making sure the sickness patients receive the care first. For the question 4, quality and safety are part of everything I do in clinical practice. During my perioperative placement, I was involved in prepare the safety checks before the surgery. We confirm two patient identifiers, check the consent form, verify the planned procedure and the surgical site. Also participate in the surgical timeout with the multidisciplinary team before the operation began. That experience reinforced how effective communication, teamwork, and following standardized safety processes help prevent error and keep patients safe. From a WHS perspective, I also followed infection prevention practices, used appropriate PPE, applied safe manual handling techniques, and report any hazards promptly. To me, providing safe care means constantly paying attention to the small details every day. Last question, I will share one experience that stand out to me was during my final coronary care placement. While completing the routine observations, a patient reported me that he had developed blood vision after coronary angiogram. Although his vital signs were stable, I recognized this could be an early sign of the neurological deterioration. I stayed with the patient, complete the focused neurological assessment with my scope of practice, and promptly communicate my findings to my body nurse using iSpar. Together, we arranged further medical review and ongoing neurological monitoring while I kept the patient informed and reassured him throughout the process. The patient received timely assessment, and fortunately, no further neurological deterioration was identified. This experience reminded me that effective communication is about listening to patients, recognize subtle changes, and working together to provide safe, patient-centered care. That's how I aim to practice it as the nurse every day. Thank you.